Good morning and welcome to the second installment of the Avoid Vaping Fast Facts Webinar. Today, Nicole Wanty, Senior Research Associate at KDH will be leading our discussion around policy change as it relates to vaping. Before we get started, I just wanted to let you all know that if you missed our first installment last week on vaping-related illnesses and deaths, you can access a full recording of that webinar on our YouTube channel, KDH Research. I would also like to direct your attention to your viewing pane where there's a section called Questions. If you have any questions as you are listening to the webinar that you would like me to ask Nicole at the end of the webinar, please type them into that section. I will be moderating those questions at the end. And with that, I will turn it over to Nicole to start the webinar.
Good morning, everyone. Thanks, Maria, for that introduction. As Maria mentioned, my name is Nicole Wanty. I'm a Senior Research Associate here at KDH, and today I'm going to be discussing policies and regulations related to e-cigarettes or vapes. Now, we're going to start way back in 2016. On August 8th, the FDA's deeming rule went into effect after an uptick in e-cigarette use among U.S. teens. On this date, it became illegal to sell e-cigarettes and other electronic nicotine device systems, known as ENDS, to people under 18. Retailers also became legally responsible for requiring individuals under the age of 27 to provide photo identification before purchasing a tobacco product, including ENDS. There were also several other modifications to the Tobacco Control Act that went into effect, including a ban on the distribution of free tobacco product samples, including ENDS, and the prohibition of sales in vending machines, except in strict adult-only facilities. Enforcement of this law is one of the most important ways the FDA regulates e-cigarettes. Now, let's examine changes in the regulation of e-cigarettes from August 2016 to June 2019. As I previously discussed, the FDA's deeming rule went into effect on August 8, 2016. Then, in July 2017, the FDA announced its comprehensive plan for tobacco and nicotine regulation, which focuses on nicotine and addiction. The FDA's comprehensive plan places nicotine and the issue of addiction at the center of the agency's tobacco regulation efforts. This plan serves as a multi-year roadmap to better protect youth and help adult smokers quit smoking, with the goals of significantly reducing tobacco-related disease and death in the U.S. for years to come. In March 2018, the FDA published 3 notices of proposed rulemaking, which focuses on 1, the tobacco product standard for nicotine level of combustibles, 2, the regulation of flavors in tobacco products, which restricts the sale of most flavored tobacco products, e-cigarettes, and vape devices at convenience stores, gas stations, and pharmacies, and 3, the regulation of premium cigars. In April 2018, the FDA unveiled the Youth Tobacco Prevention Plan, a key component of the agency's comprehensive plan for tobacco and nicotine regulation. This plan lays out a series of actions to stop youth use of tobacco products, especially e-cigarettes, with a focus on 1, preventing youth access to tobacco products, 2, curbing marketing of tobacco products aimed at youth, and 3, educating teens about the dangers of using any tobacco product, including e-cigarettes, as well as educating retailers about their key role in protecting youth. Finally, in June 2019, the FDA's Center for Tobacco Products increased requirements for ENDS manufacturers, which included, but are not limited to, submitting tobacco health documents and ingredient lists, placing warning statements on packages and advertisements for ENDS, and registering and submitting a list of products. Now, when it comes to federal, state, and local regulations, there can be some variability. All states must follow federal regulations, but states can impose additional regulations of their own. As we discussed previously, the FDA deeming rule established a federal minimum age of 18 for the sale of all tobacco products, including e-cigarettes, and retailers are also required to verify the photo ID of anyone under the age of 27 who wishes to purchase tobacco products, including e-cigarettes. There are currently no federal policies restricting indoor use of e-cigarettes other than policies pertaining to individual federal buildings or properties. However, 13 states and 752 municipalities have expanded their smoke-free air laws to also prohibit e-cigarette use in places where cigarette smoking is prohibited. Localities also have the discretion to not only prohibit the use of e-cigarettes indoors, but to ban certain ends products altogether. For example, San Francisco, home of Juul's headquarters, became the first city to ban the sale of e-cigarettes. States must follow these federal regulations, but they may create more restrictive regulations on their own. This is true in the case of the Tobacco Control Act, prohibiting the FDA from raising the federal minimum legal age for the sale of tobacco products from 18. However, several states, including California, Hawaii, Maine, and New Jersey, have raised their minimum legal age for the sale of these products to 21, and other states are considering doing the same. And you may hear these laws referred to as T21. So as you can see from our discussion of the current policies and regulations, the federal government has focused its efforts on compliance, regulation, and education. In July 2019, a U.S. District Court judge ruled for the review of currently marketed ENDS products to evaluate public health benefits and harm of the products. The judge issued a decision that requires makers and importers of e-cigarettes and other ENDS products to submit applications for their currently marketed products to the FDA within 10 months. Along with this, between April 2018 and April 2019, the FDA issued more than 3,950 warning letters and more than 665 fines to brick and mortar and online retailers for the illegal sale of e-cigarettes. There have been fines for more than 15 firms that are selling misleadingly labeled and/or advertised e-liquids resembling kid-friendly food products such as candy and cookies. Also, 4 firms that manufacture, advertise, or sell e-liquid products have received warning letters for social media violations. In total, the FDA has conducted 978,290 retail inspections, issued 777,180 warning letters to retailers for violating the law, and initiated approximately 18,560 civil money penalty cases as of September 1st. In addition to regulation and compliance, the federal government is also focused on education. The FDA is continually expanding their highly successful education efforts, such as the Real Cost campaign, to educate youth about the dangers of using tobacco products, including e-cigarettes. Also, the Youth Tobacco Prevention Plan from April 2018 includes public hearings and scientific workshops to discuss efforts to eliminate youth e-cigarette use with a focus on cessation. States have also taken steps to curb the vaping epidemic and protect youth. Amid the growing concern over the outbreak of vaping-related lung illnesses and deaths, states are stepping in to limit access to e-cigarette products. In early September, Michigan became the first state to announce its intent to limit the sales of vaping products. Michigan Governor Gretchen Whitmer issued an emergency ban on the online and retail sale of nicotine vaping products in any flavor except tobacco. She also restricted the marketing of vaping products by forbidding the use of terms like clean, safe, and healthy. The emergency ban began September 18, 2019, but by October, Retailers had filed a lawsuit claiming the governor had overstepped her authority by enacting the ban, and shops are now able to sell vape products again. On September 17, 2019, New York became the first state to implement a statewide ban on most flavored nicotine vaping products. Retailers will face fines of up to $2,000 per violation if they're caught selling flavored products. On September 24, 2019, Massachusetts announced the country's strictest vaping prohibition yet, a 4-month statewide ban on online and retail sales of all marijuana and tobacco vaping products, flavored or otherwise. This policy lasts through January 25, 2020. Rhode Island and Washington also followed suit by placing a ban on the sale of flavored e-cigarettes. And finally, though California has not enacted a statewide ban on vaping products, Governor Gavin Newsom issued an executive order focused on curtailing the state's youth vaping epidemic. Among other actions, the order allocates at least $20 million for a vaping awareness campaign and calls on state agencies to develop recommendations for limiting the sale of vaping products to anyone younger than 21 and the sales of illegal and counterfeit vaping products broadly. Now, as you've heard during this webinar, regulation is an integral part to addressing the vaping epidemic and reducing the number of vaping-related illnesses and deaths. Regulation brings about enforcement and compliance by tobacco manufacturing companies and retailers, as well as reducing youth access to e-cigarette products. However, regulation is just one tool in the effort to address the youth e-cigarette epidemic. Prevention tools such as Avoid will teach youth about the harmful effects of e-cigarettes. Cessation tools are also important in helping teens manage nicotine addiction. To learn more about Avoid and to sign up for early access to the Vaping Prevention Toolkit, you can visit avoidvapes.com. Also, if you sign up for next week, you'll learn more about vaping topics presented by KDHRC's President Kristen Holtz. Maria, do we have any questions?
Hi, Nicole. Yes, we do. And as I mentioned earlier, if you type your question into the box, I'll be able to relay that to Nicole. But here's our first question from one of our participants. I know that there are some gas stations and tobacco stores that sell to minors. How does the government enforce them to card anyone under the age of 27?
That's a great question. So the government takes several steps to ensure the sales of tobacco products to people over the legal minimum age. So the FDA conducts compliant check inspections to ensure these legal practices. And for those who don't provide photo ID or have expired ID, the retailer must decline all sales. And if that retailer does not comply, they can face civil money penalties. They might receive no sale orders or criminal prosecution. And you can actually access more information about this on the FDA website. If you actually go to fda.gov and you navigate to the Tobacco Products Campaign, there's a portion called Compliance Enforcement and Training.
Thanks, Nicole. So you have mentioned before the federal minimum legal age. So here's our next question. Why does the Tobacco Control Act prohibit the FDA from raising the federal minimum legal age for sale?
Yeah, that's a really good question. So under the Family Smoking Prevention and Tobacco Control Act, the FDA was given authorization to regulate the manufacture, marketing, distribution, and sales of tobacco products. But the FDA was not given authorization to interfere with the minimum legal age for the sale of tobacco products. U.S. lawmakers, however, are introducing bills raising minimum age for buying tobacco products. And as we discussed, certain states have already implemented these laws.
Thank you. So this is our final question. Unless any other participants want to type in another one into the box, then I can be sure to ask that to Nicole as well. But here's the final question. Why did the FDA not implement the deeming rule immediately after e-cigarettes were first introduced?
So e-cigarettes were originally manufactured and marketed by tobacco companies as an alternative to cigarettes for adults and not youth, and were believed to be less harmful than cigarettes. before the deeming rule, e-cigarettes were sold without the full review of their ingredients and their potential dangers. But then after that uptick in youth e-cigarette use, the FDA implemented this deeming rule to prevent youth from using e-cigarettes and to protect the public from the dangers of the tobacco products.
Okay, thank you. As I mentioned, those were the last of our questions. So thank you all again for tuning in to this second installment of the Avoid Vaping Fast Facts webinar. Be sure to join us again next week, Wednesday at 11 a.m. to talk about our next topic, which is about how to include parents in prevention efforts as it relates to vaping. So with that, thank you all so much for tuning in, and we hope to see you again next week. Thank you.